Good morning, people. Hi, my name is Karen, and today I just wanted to talk real briefly. I am driving to my first clinical leadership for nursing. I am a nursing student and I am in an ABSN program. So today I'm in my last semester, and I have for this semester I have leadership, nursing leadership. I have as my other clinical is public health. So those are the two that I have right now. I have an epidemiology class, I have a leadership class, and a leadership lab, and then I have a public health class and a public health lab. And my other class is nursing laws and ethics. So those are the classes I have in my last semester. So today is my first day of leadership, so I'm pretty excited about that. With your leadership, you go business casual. You want to look more professional, because you're following like a charge, not a charge nurse, but like a nurse manager or a chief nursing officer, director of nursing. So you're following that type of people in upper management. So you're not really, by bedside or anything like that. So you dress more business casual for this rotation. So I'm pretty excited about that. I like my scrubs, but I also kind of, when I'm dressed like this, more business casual, it tells me that yeah, it's true. I'm actually at the end of my road as far as nursing school. So I'm excited. It's been a rough year, like last year, just doing this program. Not used to the pace of nursing school, the amount of information you need, and because I'm in an ABSN program, it was super hard for me because I had so much information to do in such a short time. The program is only 15 months. The program that I am in, the nursing program, is only 15 months. So it was a lot of information in that 15-month time frame. So today, last week I met with my nurse, my leadership preceptor, and she mentioned to me, what it will be like. So I'm not exactly, I have an idea of what my day will be like today, but I still really don't know because I never did it before. But what she mentioned to me was that I will start off by following her while she's going through meetings and just basically like her everyday operation. But I also will start on a project, because we have a part of our syllabus is to create a change, like to do a change project. So what that means is, the light is just shining on me, and my sticker for my oil change is just reflecting on my forehead. But what she was stating was that she wanted to, she was doing a change project in regards to patient flow from a patient being discharged to the time they actually is discharged from the hospital. So according to what she stated, for the last year, there have been such a slow pace of a patient being discharged. So when a doctor gave an order, a discharge order, the patient actually, it's supposed to take within 2 hours for that patient to be discharged, and that's not happening. So for example, she stated that between 10 and 12 is when they discharge patients. So the patient should be discharged within that 2-hour time frame. However, from what the data has been showing that she printed up for the last year, it shows that patients the discharge order is put in and patients is not leaving until like later on in the evening, 2 o'clock, 4 o'clock, 6 o'clock. So my job right now, my project is to go in and look at all these data and see the purpose, the reason why they're, these patients are not leaving when they're supposed to leaving. So I'm looking for, is it because the doctor maybe came in late and put in the discharge order? What time is the doctor putting in the discharge order? So I could look at that. I could also look at the time frame from when the doctor put the discharge order to when the patient was actually discharged in record. So I would look at excuse me, I would look at to see, what's the reason. Is there a note in there why the patient hasn't been discharged, why it's taking so long for the patient to be discharged? Is the patient waiting for a family member and that's why they're still here and that's why they're not officially discharged? Is the ambulance that they're waiting for taking a longer time than normal to come pick them up, to take them to like a nursing home, for example? So my job is to see what are these barriers of why the patient is not getting discharged when they're supposed to. Because on the back end of all this, when you really calculate all this, for example, if there is for example, in the evening time, and according to what my nurse leader preceptor told me, she said that they do census at 5 o'clock for the nurse that they need for the 7 o'clock p.m. shift. So if they're doing census and they have 20 patients who's there, 2 of them maybe is planning to be discharged, but they're still there because of, for whatever reason, why they didn't get discharged. So they have to factor in those 2 patients that's still there, and they are pulling their nurses. They are filling their census based on the amount of patients that they still have as admitted. So so now those 5 nurses come, because it's like 5 nurses to 5 patients to a nurse. So we have 20 patients. Now we have 5 nurses that is supposed to start, because that's the census. Census is 20 patients. So they have 5 nurses. And then 2 hours later, after the shift starts, 2 patients got discharged, or 2 patients got discharged within the 2 hours after those nurses start. So now you have 5 nurses and you have 18 patients. So this is what she's talking about. I mean, the numbers, I'm just throwing these numbers out there, but this is what she's talking about. So now she she technically overstaffed to fill the census of the patient to nurse ratio, while a few of those patients are actually getting discharged within an hour or so of the nurses starting their shift, or and they don't have time to call the nurses before they come in to let them know, hey, don't come in because the census dropped, we don't have enough patients anymore. And if the nurse is in, they have to pay that nurse for the first 4 hours because they're there, and then they can send them home. But just calculating that 4 hours of paying that nurse, and this is only on maybe 1 floor, and these numbers could be more, more patients getting discharged instead of less. So these numbers are more. I'm just giving you just a small example of what it's like. So that one nurse that they could have called out but they didn't call out cost them so much money on the back end because of the discharge. So my job is to go figure out what's going on the front end so we can avoid this on the back end, save the hospital money, because hospitals, they can take that money, they can put it into the nurses, giving the nurses raises, or upkeep of their hospitals, getting the supplies and things that the hospital needs. And that money, instead of just wasting that money because of what's happening on the front end, it could really be beneficial for nurses in the back end. So that's my change project, and at least that's the overview of what I think is a change project. So now that I will actually go in there and actually see what's going on and try to figure it out, I'm pretty excited about it. I'm pretty excited to see what's really going on. Like, why are these patients getting discharged so late? And just going back and looking at the data and seeing exactly what's going on, and seeing if nurses have notes in their record to say why the patient haven't been discharged yet, because just having these notes can give you a lot of information, so you can actually try to fix the issues. And if it's not there, if these notes are not there, then this is one of the things that we want to implement, so we know what's going on. So later down the road, we can go back and really see. We can keep changing this, keep tweaking this until it's better. That's the whole project. Purpose of a change project is just to make a change, make things better for nurses, for patients, for the institution, organization. So yeah, I am pretty excited about that. And I'm kind of nervous too, just to be honest. I'm nervous because like I have to go, I'm in a leadership position per se, and I have to speak to all these people in these powerful positions, and also they will be looking at me because a lot of students get hired based on their leadership rotation. So I don't know, if everything goes well, if they like me, who knows, maybe I could get a job opportunity from this. Maybe they can recommend that I come back. They can write me a recommendation to get into the new grad program at the hospital. A lot of things could come out of this, so I'm pretty excited about it, and nervous too. But it's always like that. You'll always be nervous, especially when you don't know something, and when you get comfortable, then it'll be a lot better. So I'm excited about that. And then I have my public health rotation, which is, I'm super excited about that because I worked at a homeless shelter for 5 years, and I am really into outreaching to the homeless population, the population that's on the, that's actually living on the street and not in a shelter per se. I'm really passionate about that too. So I haven't done my clinical rotation yet. I just been to orientation and to a couple meetings, but I haven't like digged in and start doing like the footwork and just going out there and just to see what public health is really like. So whenever I start doing that, I will definitely make a video on that. And hey, you guys, just go ahead and subscribe if you want to hear more, if you want to learn more about ABSN nursing student going through this rigmarole. One of the other things I will also be doing is I will start my NCLEX review, and I will also do my NCLEX review, and looking into new grad programs. What my classmates and I are doing, we created a Google Doc, and we are just all like putting all the hospitals that we know that have their new grad program starting pretty soon, and we're just putting dates and their requirements and things like that. So if everybody do that, then it just becomes easier, and then you have a Google Doc. You can just go see where you want to apply to and go ahead and apply. So we're trying to work easier instead of harder, and so that's good. I'm also a part of a mentorship program. So our nursing program, we started a mentorship program, which is we are mentoring the new cohort that's coming in. We are cohort number 1. So we are mentoring the new cohort coming in because it was such a struggle for us just going through this program and initially, and we didn't have any mentors or anybody that we could look up to or ask for suggestions, or just somebody that's there for us when we're stressed, somebody that we can talk to just reassure us. So it was pretty hard for us going through this program because for me specifically, I did not expect this program to be the way it was. It hit me like a brick, and my anxiety was through the roof. Many times I questioned myself, is this right for me? And I know I always wanted to do nursing. I know a lot of people say that, but all my jobs prior to this has been anything to do with helping someone, helping people. Like, I am a natural helper. Like, I'm a people person, and I like to give my services. It's just who I am. I love to give my services. It brings fulfillment to me. So I already knew that I would be in some sort of thing that has to do with me helping someone. So but I also knew that nursing was for me because I just knew it is what it is. I just knew, and that's where I'm happy. It's, I'm more passionate about this, and yeah, so anyways, I'm going on blabbing, going on and on. So you guys can just keep watching, keep looking at my videos and subscribing, and I will just share whatever tips, tricks, whatever information I have in regards to nursing school. And then you guys can also, whatever questions you guys have, just place it down there and I'll do my best to answer it as well. Because I know, I had a lot of questions. So, if there's whatever question it is, if there's too much for me to answer and it's the same thing, then I'll just make a videos on those questions. Or I'll make a videos answering people's questions. How about that? So I will do that. So anyways, this is Karen, and thank you guys for looking at my video, and I will talk to you guys pretty soon. Bye.